This computer. I think it's recording. Okay, cool. Okay, all right, so we are going to do our presentation on the hyperbaric oxygen therapy. My name is Tyrel.
I'm Lindsay.
My name is Dimithri.
And I'm Sean. I'm going to start by giving a brief overview of what hyperbaric oxygen therapy is, and then I'm going to take you through the history and development of it over the years. So hyperbaric oxygen therapy is the use of oxygen at atmospheric pressures greater than 1 atmosphere. This is usually expressed in the units of atmospheric pressure absolute, or ATA, and is usually done between 2 to 3 ATA, but sometimes can be up to 6 or greater. There's 2 main types of chambers that are used for this, although there are others. The first one here is the permanently fixed chamber, which is large enough to allow patients and healthcare providers inside with them. And there's also a movable monoplace chamber, which is only big enough to allow 1 patient to lie down in. Now in history, in 1662 was the first time that a hyperbaric environment was achieved, and it was done using compressed air by Nathaniel Henshaw. The reason it was only compressed air mainly was because it wasn't until 1775 that oxygen was discovered, but even after oxygen was discovered, they found in 1789 that there are toxic effects of concentrated oxygen, which caused a great hesitation to use it in healthcare settings. There was a long period without much change for hyperbarics, but in 1860, the very first chamber to be built in North America was built in Oshawa, right here in Ontario, and only 1 year later, the first one came to the United States. By 1877, the hyperbaric chambers were being used to treat many conditions, even though there was no actual scientific evidence supporting its efficacy. In 1878, a man named Paul Burt had clearly documented the toxic effects of O2, which opened up the possibility of entering oxygen back into this field. And 1887, a review was done by Artzenius on literature, which he found an abundance of references supporting the medicine, which really started to speed up the process of creating more research happening as the same year animal testing began. It was 1917 that the very first application of pressurized O2 was used, which German inventors Bernhard and Heinrich Drager used it to treat decompression illness from diving accidents. In 1921, a man named Orville J. Cunningham built a chamber in Kansas, which this is the most famous and utilized in the United States. He built it to test patients who had the Spanish influenza because he saw morbidity and mortality rates greater in higher elevation situations. So he saw some excess in the short period he was running this, but at one point a compressor failed and the pressure dropping back so quickly to the normal atmospheric pressure killed all the patients. Because he didn't understand why they died, he just made the assumption that the higher pressure was what was keeping them alive and didn't associate what he did to killing them, and just assumed that they couldn't survive in a normal climate or environment anymore. By 1925, this chamber of Cunningham's was the only operational one in the world. And 3 years after that, he built the largest chamber in the world, which weighed 900 tons. It was 64 feet in diameter, 5 stories tall, had 12 bedrooms per floor, and he used this focusing heavily on diabetic treatment, but he also treated many other conditions. That chamber was only up for 9 years, and after that it was dismantled for scrap metal. The year it was dismantled, a man named Albert Banke and Lewis Shaw built on Drager's work, who originally added the oxygen to treat decompression illness. And he created a chamber that used a mixture of nitrogen and oxygen in the hyperbaric setting, which he could adjust the levels to be appropriately tailored to the severity of injury or condition. In 1956, a Dutch surgeon named Hyperbaric reported the use of hyperbaric oxygen treatment in aiding in cardiopulmonary surgery. This kind of struck the modern era of hyperbaric oxygen therapy. Around the time, physicians started creating a list of diagnoses to use the therapy with, but their list, they used scientific evidence that wasn't necessarily true in an attempt to jumpstart the field and gain funding. This confused many disciplines of healthcare down the road, which really hindered the advancement of the field for a long time. By 1961, it was reported that anaerobic infections were inhibited by the hyperbaric oxygen therapy, and this really set it forward a big step, which started using hyperbaric oxygen therapy for an abundance of different conditions. By 1999, the FDA created a new definition for what it was, which they used, quote, a medical treatment that uses high pressure oxygen as a drug by fully enclosing a person or animal in a pressure vessel and then adjusting the dose of the drug to treat pathophysiologic processes of the disease. Now, this didn't explain the 300 plus years that hyperbarics only use pressurized air, which then got fixed in 2012 when they created a new definition saying that where it considers hyperbolic oxygen treatment as a combination therapy of hyperbaric and hyperoxic treatments, and that these treatments contribute to the therapeutic effect individually.
Okay, so I'm going to be talking about the anatomy and physiology. So when a patient lies in the hyperbaric chamber, oxygen levels in the blood plasma can increase to 10 to 20 times than what is like the normal range. So there's a huge increase in the amount of oxygen that a patient takes in. So normally we take in 21%, but in the hyperbaric chamber, we take 100%. And they would breathe this oxygen for 90 to 120 minutes, depending on the treatment. The primary use of the hyperbaric chamber is with non-healing wounds, which typically require 20 to 30 treatments. However, the use of a hyperbaric oxygen therapy can be used for a variety of other conditions, such as carbon monoxide poisoning, crash injuries, gangrene, compromised skin grafts, delayed radiation therapy, and a variety of diabetic wounds, such as a diabetic foot ulcer, venous arterial insufficiency ulcers, and other conditions. So let me show you the difference that hyperbaric oxygen therapy does. So in a normal blood flow, oxygen diffuses into the surrounding tissue, ensuring that it gets delivered to where it needs it most. So when a blood vessel gets restricted due to injury, illness, or surgery, the blood cells block the blood vessel and cannot transfer to the other side. So this really releases fluid that leaks into the tissues, causing swelling, and the swelling starves the area of oxygen, resulting in a tissue breakdown. So in terms of the hyperbaric oxygenation, so oxygen-rich plasma can pass that restriction. So the pressurized environment helps reduce the swelling and discomfort when providing the body with 10 to 20 times the normal oxygen supply. And this helps repair the tissue damage by the original occlusion or subsequent hypoxic conditions. So restoring blood supply to the area by developing new capillary network. And then this elevated pressure in the chamber also increases the amount of oxygen in the blood. And then lastly, neurovascularization occurs. So an essential component of tissue repair, especially in radiation-induced therapies, is neurovascular regeneration. So this encompasses Angiogenesis, which is the process through which new blood vessels form from existing blood vessels by mobilizing the body's circulating stem cells.
So with respect to applications, hyperbaric oxygen therapy is currently a recognized treatment option for 14 conditions. These conditions are listed here. There's an organization called the Undersea Hyperbaric Medical Society, or the UHMS, and this is the main source for the latest research and information pertaining to hyperbaric medicine, and this is where the indications for hyperbaric oxygen therapy can be found. Today, I will discuss the conditions that are most relevant to respiratory therapists, starting with air or gas embolism. So this condition is essentially a blockage of the blood vessels by gas bubbles. These obstructions can happen in veins and arteries and are known as venous gas embolism and arterial gas embolism. So patients with this condition can experience a variety of symptoms, such as hypotension and breathing problems. The main cause is during iatrogenic procedures, such as surgeries, endoscopy, and thoracentesis. So hyperbaric oxygen therapy helps maintain oxygenation and helps with gas bubble resorption. So decompression sickness, this is also related to gas embolism, and it's the formation of gas bubbles in tissue, which can lead to organ dysfunction. Decompression sickness is caused by reduction in ambient pressure. This can occur during a rapid increase in altitude, but it mainly affects divers. It usually happens when divers ascend from a depth of about 20 feet, and hyperbaric oxygen therapy is the primary treatment option for this condition because it immediately reduces bubble volume. Also, it helps with the oxygen diffusion and tissue oxygenation. And for the enhancement of healing problems and wounds, this treatment is actually very useful. So wounds that have a hard time healing are usually due to hypoxic wound sites. So oxygen is very important for angiogenesis and epithelialization. So diabetic wounds of the lower extremities are the main wounds of concern, and these include foot ulcers. So hyperbaric oxygen therapy helps with the hyperoxygenation of the affected tissues, which also decreases inflammation and stimulates growth factor production. And lastly, with consideration to potential applications, the current pandemic is a condition that is being considered. COVID-19 is known to cause hypoxanemic respiratory failure, and conventional oxygen therapy may not improve patient oxygenation. This includes the use of nasal cannula, uh, mechanical ventilation, and other options. So since there is currently no treatment for COVID-19, hyperbaric oxygen therapy is currently being proposed as a supportive strategy to help increase oxygenation and decrease inflammation, which are both very useful for managing the symptoms of COVID-19.
I'm going to finish off by summarizing some of the benefits and risks that are associated with this therapy. Hyperbaric oxygen therapy has many advantages due to the diversity of its application. This can be used to treat a wide range of diseases, injuries, and other conditions through various body processes. For example, patients may be admitted for treatment of wounds that have not shown signs of healing in the appropriate time frame. Hyperbaric oxygen therapy enhances healing by inhibiting apoptosis at the site of injury and promoting vascularization of surrounding tissues while reducing inflammation. This is also a viable treatment option for wounds that have begun to show signs of tissue necrosis. Treatment may also provide some relief over chronic pain associated with certain diseases such as fibromyalgia. In addition, treatment can reduce the volume of vascular gas bubbles often found in divers who have surfaced too quickly to allow for proper decompression. Hyperbaric oxygen therapy also causes hyperoxia within the patient's tissues. An elevated concentration of oxygen in the patient's blood supplies the body tissues with supplemental oxygen and is advantageous in patients with conditions involving oxygen deficiencies. An excess of oxygen can also create a bactericidal environment to anaerobic bacteria, which could help in cases of infection involving those microbes when antibiotic application is insufficient. So with any treatment plan, the risks must also be considered alongside the benefits. During hyperbaric oxygen therapy, patients are exposed to concentrated oxygen at high pressures in a closed space, each of which comes with its own risks. Oxygen is highly reactive with combustible materials, making a hyperbaric chamber a potentially explosive environment. With the delivery of highly concentrated oxygen under pressure, there is also the chance of triggering seizures in patients. This is a rare occurrence that is caused by oxygen toxicity to the central nervous system and often requires drug administration to relieve the effects. Additionally, the delivery of oxygen at such high concentration has the potential to induce hypercapnia, or high blood CO2 levels, in some patients due to changes in the ventilation perfusion ratio. Due to the high pressure system within a hyperbaric chamber, damage can occur with regards to pressure sensitive areas of the body. This includes barotrauma to the middle ear, teeth, sinuses, and lungs. In addition, hyperbaric chambers are compact. Patients with a fear of small spaces may experience claustrophobia while enclosed within the chamber for treatment. Hyperbarics is an ever-changing field that has been used for hundreds of years. As more is learned about the science behind the treatment and how it relates to the body's healing processes, healthcare professionals are finding more uses for this specialized form of oxygen therapy. Finally, current research into the COVID-19 application shows that hyperbaric oxygen therapy is a strong supportive strategy to be considered as we try to tackle the current pandemic. Thanks for watching.